So sorry to keep you waiting. I'm Dr. Heather Collins. You must be Christy and Lynette Wheeler?
Yes.
Yes, we were supposed to see Dr. Abbott.
I guess this could be the case of the pregnant teen coming for mifepristone, an anti-progestin used in medical termination of pregnancy as alluded by Dr. Jack in the first episode. Mifepristone dislodges the implanted fetus from the uterine wall, and misoprostol stimulates uterine contractions and dilates the cervix for the removal of the fetus.
Yes, Dr. Abbott is an amazing physician, but even he needs sleep occasionally. Okay, I see we're doing a medication abortion today, correct?
Yep.
Well, since I didn't initially assess you, do you mind if I ask a few questions? Get up to speed?
No.
Thanks. Is this your first pregnancy?
Yes.
And you're 17? When did your last menstrual cycle start?
LMP stands for last menstrual period, which refers to the first day of a woman's last menstrual period before she became pregnant. It's an important question to ask as it determines the period of gestation, which is important in a medical abortion. Medical abortion is usually considered most effective and safe up to 12 weeks of pregnancy.
Not exactly sure. End of June. 23rd, maybe?
Any allergies to medication?
No.
Any surgeries in the past?
No.
I need to do another quick ultrasound to make sure everything's okay for the medication. Do you want to put on a gown to make sure you don't get gel all over your clothes?
Since the history of LMP isn't quite reliable here, or at least it looks like so, as the girl is uncertain here, an ultrasound is typically to be done here to determine the gestational age, that means the duration of the pregnancy. Ultrasound helps to accurately measure the size of the embryo or fetus and determine the gestational age. This is helpful because medical abortion is most effective up to 10 weeks, and its success decreases after 12 weeks. An ultrasound also helps to confirm that the pregnancy is intrauterine, that is inside the uterus, rather than ectopic, that is outside the uterus, usually in the fallopian tubes. An ectopic pregnancy is a medical emergency and cannot be terminated with medical abortion and requires immediate surgery. Ultrasound also helps to rule out other conditions such as fibroids, ovarian cysts, or other abnormal growths which might interfere with the abortion process. So these are all what she meant when she said the purpose of ultrasound was to make sure everything's okay.
Okay.
I'll be right back.
Thank you.
A little jelly on the belly? Sorry, it's cold.
She's performing an ultrasound before medical abortion to check for the gestational age and confirm that the pregnancy is intrauterine and not ectopic, and also rule out any other abnormality.
And just to be sure you're not being treated for any blood clots, taking any anticoagulants?
So it's very important to ask this because medical abortion does cause heavy bleeding, especially after taking misoprostol during the expulsion of fetus. If patient is on anticoagulation, it significantly increases the risk of excessive hemorrhage and patient to go into hypovolemic or specifically hemorrhagic shock from profuse bleeding here, requiring blood transfusions.
No, I don't take any medicines.
So this is an ultrasound of a normal fetus inside the uterus.
Is everything okay?
Yeah. Christy Wheeler, 17 years old, pregnant. These are Abbott's fetal measurements from yesterday, and these are mine.
10.5 and 11.2. Wow, ultrasound is an art, not a science. Even in the very best hands, the EGA differential could be within 3 to 5 days in the first trimester.
EGA means estimated gestational age, which means the age of the pregnancy, which is calculated here using ultrasound. For this, different measurements of the fetus are taken by ultrasound, like crown rump length or CRL, which is the most accurate for the first trimester to determine the gestational age. It simply means the measurement of a fetus's length from the top of their head to the bottom of their buttocks. BPD, or biparietal diameter of the fetal head, can also be taken, along with femur length and head and abdominal circumference, usually in the second trimester, where we usually perform ultrasound dating scan. Now these measurements are tallied up in ultrasound to determine the estimated gestational age. For CRL, usually there is an error margin of about 5 to 7 days. The mean gestational sac diameter could also be measured early on, but isn't that reliable. CRL is the one to be looked for here.
Definitely room for error.
Not if you're here for medication abortion and you're past the mandated 11-week cutoff.
Oh, so here the gestational age is beyond 10 weeks. In the United States, the FDA has approved the use of mifepristone for medical abortion up to 70 days or 10 weeks of gestation. It's important to note that abortion laws vary by state. However, the point here is beyond 10 weeks, the safety and efficacy or success of medical abortion decreases. As the age of gestation increases, there is slightly increased risk of incomplete abortion and heavy bleeding, and it could pose a risk to the woman's physical or mental health.
There can also be inter-operator variability.
I measured the gestational sac 11.3 and the biparietal diameter 11.1.
This means the gestational sac diameter and the BPD measurements here indicated that the gestational age was 11 weeks and 3 days and 11 weeks and 1 day respectively. Dr. Jack's measurements alluded to it being 10 weeks and 5 days. Important thing to note here is that the mean gestational sac diameter doesn't hold that much value here. It would only hold value if the pregnancy was below 6 weeks, at which point the CRL couldn't be measured. But here, the CRL can be measured, so that should be the one determining the gestational age.
I didn't get a single measurement under 11 weeks.
So what are you saying, that Abbott lowballed his measurements to help a teen get the abortion that she wants?
Maybe.
Well, then you've got two choices. You can go with Abbott's measurements, or you can redo your measurements, go back in and pick an angle that shows 11 weeks or less.
This is a completely unexpected turn of events. Is this turning into a political debate where one is for it and the other is against it, and hence the difference in opinions? Interestingly, the scene is created where the USG measurements are exactly hovering over the said mandate of 11 weeks. An error of 5 to 7 days is expected, even with the best measurement at that age, which is the crown rump length. Let's see what happens.
Please tell me you're joking.
You were ready to roll up your sleeves and arm wrestle the ethics committee a couple hours ago to override Mr. Spencer's children. What changed?
Apples and oranges. There was a clear, bright line that Mr. Spencer was never going to make it.
She does have a point. Intubation and ventilation was a mistake at the end stage of the patient's life, and that was eventually undone by extubation.
Falsifying medical records for Christy is flat out illegal.
She's 17. She deserves a life.
Of course she does. But I will not jeopardize my future in the process.
You'll be fine.
Someone finds out I falsified medical records, I'll get booted from the residency program. You've got tenure. Worst case, you have to take a job in Youngstown. The risks are not the same for you as they are for me.
First of all, the measurements here aren't that far. 10 weeks and 5 days of Dr. Jack versus 11 weeks and 1 day for her. Second of all, I wouldn't want to go into the political debate for this. As doctors, we would want the teen's health to be taken care of as the #1 priority, with no complications occurring during and after the abortion process, if that happens here. The complications of abortion could be heavy bleeding, incomplete abortion, or sepsis due to the retained products of conception.
You're right. I'll do it.
What?
Erase your history, physical, and impression from Christy's chart and be like you never saw the patient. I will take over. I will complete a new chart and upload my own image.
Robbie, I'm not asking you to.
As you're attending, it is my decision. I am a certified provider for mifepristone. You are not. And as a prudent physician, I should examine every patient before I order.
Again, an unexpected turn of events. Whether it's trying to encourage a peaceful death, or trying to help a young child with violent ideations get the necessary help he needs, or whether it's trying to restore the teen's life, it's undeniable that Dr. Robbie is not hesitant to go beyond the standard norms to help people's lives here.
I still don't understand why Christy needs to go through this a third time with a third doctor.
Yeah, that's our bad. Our computerized medical records have been glitching lately, and Dr. Collins' image didn't upload properly. Okay, crown to rump. That's top of the head to the bottom of the butt. Is how you measure gestational age, and we are at 10 weeks and 6 days.
We've already discussed crown rump length before as the most accurate and reliable measurement for estimating gestational age of fetus. The resident was holding on to the gestational sac measurement, which doesn't hold value after 6 weeks when CRL becomes measurable, and another measurement, the biparietal diameter, is reliable in the second trimester, meaning beyond 12 weeks.
I made it by 1 day.
I will order the medication. Dr. Collins will go over instructions on taking the pills when they come back from the pharmacy.
Thank you so much, Dr.
Oh,
Robbie.
I'm glad I could help. Even more glad to see you have such a supportive mom.
A little bit about medical abortion here. Where I work, the protocol says to take a tablet of mifepristone 200 milligrams followed by 800 micrograms of misoprostol 24 to 48 hours later. Misoprostol can be administered buccally, that is placed between the cheek and gum, intravaginally or sublingually, that means placed under the tongue. Mifepristone, acting as an antiprogestin, dislodges the implanted fetus and makes the uterine environment unfavorable for continuation of pregnancy by blocking the progesterone hormone receptors, while misoprostol is a prostaglandin which helps stimulate uterine contractions and dilate the cervix for the expulsion of the dead fetus outside of the vagina via heavy bleeding.
Okay, take care.
Appreciate you stepping up.
All good. I got you.
Robbie, Emma Isaac's on line 3 for you. She's the organ donation counselor coming to speak to next experience.
The brain-dead child is being considered for organ donation here if the family consents. Even though his brain has died, the ventilation is keeping his respiration and heart going to prevent hypoxia and preserve organs from hypoxic damage that could then be donated.
What's that all about?
Oh, nothing.
Didn't look like nothing.
Please.
Why do you two or what's the thing?
We dated briefly 1,000,000 years ago. Never again.
Never say never.
Settle down, Jane Austen.
The lady doth protest too much.
Again, another unexpected revelation here. I've been wondering throughout the previous episodes why the resident is talking to the attending as if he were her friend. Usually there is no pushback or questioning to your attending unless it's a big issue. So this makes all the sense now that they talk like equals and not junior senior.
Since you're past 10 weeks, you'll need to take mifepristone twice. Once now and once in 24 hours.
We briefly touched on the protocol for medical abortion and its mechanism of termination of pregnancy before. Mifepristone 200 milligrams, and then after 24 to 48 hours, it's followed by 800 micrograms of misoprostol to be taken sublingually or buccally or intravaginally. However, I have never heard of taking mifepristone twice. At least that's not done where I work and live. But from my understanding, misoprostol is the one which can be repeated if it's not effective. After 10 weeks, the success rate of medical abortion decreases, and so there could be risk of incomplete abortion and retained products of conception. That's why, after 10 weeks, repeat doses of misoprostol could be required. 800 micrograms of misoprostol could be repeated every 3 hours for a maximum of 3 to 5 doses to ensure complete expulsion of fetus.
Then 24 hours after that, you'll take misoprostol, 2 pills which dissolve between the cheek and the gum. Then 2 more of the same pill 6 hours later.
Just a note here, the 4 pills containing 200 micrograms of misoprostol can be taken altogether. Secondly, here the buccal route is explained meaning putting medicine between the gum and cheek, but sublingual under the tongue can also be given or intravaginal routes as well.
It's a lot to remember.
Everything is clearly labeled with the names of the meds, the dose, and the exact time to take them.
Will it hurt?
You can expect some vaginal bleeding. There may be some cramping, like when you're on your period.
Bleeding is expected in abortion since it involves the expulsion of a fetus which was dislodged from the uterine wall.
If you're bleeding more than 2 pads an hour, or the pain gets to be too much, come back in and see us.
And I'll be with you the whole time.
Heavy bleeding involving soakage of multiple pads or passage of clots has to be taken care of in the hospital via fluid resuscitation to prevent the patient from going into hypovolemic shock due to loss of blood volume.
Christy!
What the hell are you doing
Hey,
here?
language. And I should be asking you the same thing.
Excuse me, who are you?
I'm her mom.
Mom. Aren't you her mom?
I can explain.
No, that's my sister, Lynette. I am Christy's mother. Chris, baby, what are you doing here?
Unexpected turn of events again. The girl, as mentioned by Dr. Robbie earlier, is just 17, which means she is a minor and her aunt is not her parent. This could have legal implications here.
I'm here for an abortion.
Did you do it already?
Not yet.
Okay, thank God.
Okay. Okay, can we all just take a step back here?
Mom, I want this. This is my decision.
The abortion of a minor depends upon the laws of abortion, which varies from state to state. Some states demand a parental notification, meaning that the minor must inform a parent but doesn't need their approval. Some require parental consent, meaning permission from a parent. Some have the option for judicial bypass, meaning the minor can ask a judge for permission without involving parents. Some states have no requirement, meaning minor can get an abortion without parental involvement.
No, just listen to her.
Okay,
Al.
shut up! You have done enough. My daughter is a minor, so she can't get this abortion without my say-so, right?
In Pittsburgh, Pennsylvania, the law mandates that an unemancipated minor must obtain informed consent from at least one parent or legal guardian before an abortion can be performed.
Is that right?
That's correct.
Then there is no way this is happening. Not now, not ever.
Now, if a minor cannot obtain parental consent, they do have the legal right to seek a judicial bypass in the court of law.